So aside from a posterior approach for hips, there's also an anterior approach that we want to consider while treating patients. There are several precautions that we want to talk about. The first precaution we want to talk about is avoiding extension. The next precaution for an anterior approach is known external rotation. And the last and final precaution is known adduction. And those are the three precautions you want to consider while treating patients with an anterior approach.
Let's look at this situation. It seems like the client is getting dressed with his reacher. Reaching for his shoes? Would you say there's anything wrong with the situation? If so, what? For this next picture, I want to know which approach would you teach a client as they're exiting their bed? Client on the left or client on the right? Correct, we want to teach the client to move their body as one. Client on the left is only moving her leg, and as the client moves that leg onto the floor, the client is externally rotating. For this next picture, it seems like the client is once again getting dressed. However, this time the client is reaching down for his pants. Would you say with an anterior approach, the client is following his precautions? Correct, it seems like the client is following all his precautions. For this next picture, the client is reaching up for an object on the upper shelf. Would you say there's anything wrong with this picture? Correct, as the client is reaching up, it seems like that her leg has lifted off the floor and is extending. In order to prevent this from occurring, the therapist can provide the client with a reacher in order for her to reach items up over her head. Like this next picture, the client seems like she's following all her precautions using a reacher in order for her to reach those higher items. Let's take a look at this next picture. It seems like the client is just relaxing on the couch, getting some rest. Would you say the client is following his precautions with an anterior approach? That's right. As the client is laying down, it seems like both legs are externally rotating out.